What lessons can we take from the polio eradication efforts to be applied to other health challenges?
It's a very good question, and there are a number of lessons. First of all, there's a sense of community responsibility, especially with a viral disease. The more of us who are vaccinated, the more people who can't be vaccinated are nonetheless protected. The lessons of disease control, of disease eradication, can also be brought to lessons of world peace, of school construction, of funding for after-school activities, for anything that people do that requires them to give of themselves for the community at large. So I think it's a larger lesson that doesn't even necessarily apply just to disease control. It does apply in a large sense to human relations.
It's really that innovation that you constantly need, the research, the partnership, the sharing, and you need someone to raise the money. You need passion, and that's what I'm proud as a Rotarian is. I meet Rotarians around the world who are so passionate about the eradication of polio. And so whatever disease that you're looking to eradicate, if it's not Rotary, you need a group that's truly passionate to get it done.
Probably one of the biggest lessons we can learn is just the power of people and bringing people together in so many different facets. And we have the private and the public community working together to solve this big problem, like eradicating polio. Like you look at a country like India in 2014, it became polio free. And it is such a complicated country. I mean, years ago, there were hundreds of thousands of cases of polio. And to be declared polio free is such a win for not only for the country, but for the cause of itself. Because it really proves that we can eradicate the disease from our planet, and we are that close.
We have learned that we can eradicate a disease, that's the good part, but we've also learned that the challenges that there are, the lack of trust in healthcare providers, the lack of trust in the system, the lack of communication, whether it be for religious values, for community, but for whatever reason, people not vaccinating their children are not taking their health into their own hands and doing what's best for themselves and the community and the world. That's the challenge.
There are three things, I think, three stages of success with polio. Now, first was they just started doing something, right? And I realized that at the organizational level, Rotary took several years of real thoughtful analysis around this. But while that was happening, clubs around the world were actually immunizing children against polio while that discussion was happening. The key to success was not Rotary International thinking about it. The key to success was Rotarians immunizing children. It was that action-oriented approach. So that was the first key. The second key is building partnerships, right? Rotary didn't do it alone. Rotary started with the CDC from the get-go, but they've added, of course, UNICEF, the World Health Organization, and the Gates Foundation, and the world's governments. I mean, they have more partners than you can count now. And that is why it's been successful, because they had that global support. And then the third thing, and I think even Rotary was surprised by this. If you go back 5 years ago, I don't think they appreciated what it would take to finish the disease off. They had such great momentum that I think they just thought if they kept doing what they were doing, that the disease would peter out. And they became aware by 2010 or 11 that was not the case. And they had to begin developing a strategy, an end game strategy, an extra effort where they really have about tripled the effort in order to solve the problem, to push it over the finish line. And I think that's what often is underappreciated, is how much extra effort it took at the end to really eradicate polio.
I think what was critical, at least from my perspective, in this whole effort, was the concept of partnership, where we got together with WHO, CDC, UNICEF, and more recently the Bill and Melinda Gates Foundation, and we created a partnership that worked extremely well, that had a very focused target. And I think what the biggest lesson that can be learned here is that each partner had a very clearly defined goal and objective in that partnership. And so it's really a question of 1 + 1 is 3.
The real lesson learned is diverse partners, the globe coming together from east and west, young and old, and really it's uniting for against a common adversary, which is polio. All the stakeholders have come together on one platform. So that means the federal government, the provincial governments, Rotary, UNICEF, WHO, the frontline workers, students, and religious leaders. Actually, the message that has gone from the religious leaders is that this myth which some have propagated that, it's un-Islamic, the vaccine is un-Islamic, or there's something wrong with it, they've really sort of bulldozed that. So it's them coming on board, and plus I also say the Pakistani army, which has gone into the insecure areas, cleared them out so that we can reach the young children and vaccinate them. If we can do that in health education, we can change the world.